Hello, everyone, and welcome to the first edition of the Diabetes Care Summit. I'm Dr. Barbara Akimbua, and I'm your health buddy. This summit is for you if you've been diabetic for a while and you've been struggling with keeping your blood sugar controlled, either because you have problems knowing what to eat, when to eat, how to eat, what else you need to do to keep healthy, or you do know these things, but it's difficult to be motivated. It's also for you if you have an elderly parent who is diabetic that you care for, and you find juggling medications, clinic visits, meals, and then illnesses in between overwhelming. Or you're a beautiful married woman and all you would love to have is a normal pregnancy and delivery. And instead, you keep having miscarriages and stillbirths as a result of complications of diabetes. Or it could be your husband. He is the one who's diabetic. And during sex, you have problems. It's either most of the time he can't get it up, or he has other problems while you're having action. It's also for you if you're a health enthusiast and you believe that prevention is cheaper and better than cure. And so you'd like to learn anything you need to know to stay healthy. During this summit, you listen to loads of interviews by different specialists, including myself. Some of the interviews are short and some are not so short. But I'd encourage you to watch each video till the end because there's loads of important health information and you're getting it all for free. So, once again, welcome to the Diabetes Care Summit, and don't forget, I'm Dr. Barbara Akimbua and I'm your health buddy. See you on the healthy side. Today we'll be talking about topics that are related to diabetes and diabetes care. So in Africa, pregnancy is a very important topic. Africans love marriage, Africans love children, and as a result, Africans love pregnancy. So if there's anything that can affect a woman or a family getting pregnant, then it's a very important thing for us. As usual, I'm going to be speaking with a colleague of mine who is a specialist. I will not let the cat out of the bag. I'll let her introduce herself and tell us what she does, and then we'll take it from there. So over to you.
Thank you very much, Dr. Akimbua. I'm happy to be here on this platform. My name is Dr. Arichi Eti. I am a consultant obstetrician gynecologist. I work currently with the Federal Medical Center, Makurdi.
Welcome.
Thank you for having me here. Thank you.
Yeah, welcome, and thanks for agreeing to do this. It was a deliberate choice. We are classmates, first of all, and then I wanted a female obstetrician and gynecologist because there aren't very many of them, one, and a lot of the time the issues it's women that get pregnant, even though it's the man that makes them pregnant. So it's nice for once to be talking about this with another woman. So yeah. So what are the requirements for a woman to get pregnant? Let's start from the basics.
Okay. All right. That's really going down to the basics. Okay. Pregnancy is the result of many, very well organized set of activities that take place in the body of both the man and the woman. Okay? For a successful pregnancy, what is required is that the woman will be in a good state of health with healthy reproductive organs that are equipped for conception and pregnancy. The man too should be in a good state of health and he should be able to produce and successfully deposit healthy sperm into the reproductive tract of the woman. So once during intercourse this happens, the sperm is deposited into the vagina and they swim up through the cervix, get to the fallopian tube, fertilize an egg if an egg is present. Once the fertilization takes place in the tube, the fertilized egg, now known as a zygote, is transported back into the uterus and is implanted. And then the pregnancy continues to grow from then onwards. Okay, so a healthy woman will be needed to be able to carry that pregnancy to 10 to 9 months, as we all know, and deliver this baby. So this is what it takes, in summary, for a woman to be able to get pregnant. I hope I have answered the question.
You've tried, and I like the way you started. You said a set of well-organized events. And then from your description, it sounds like going on a journey. Yes, so, but the important thing is both the man and the woman need to be in a good state of health from the beginning. And then their reproductive organs have to be healthy enough to carry out the reproductive function. So, so can diabetes affect pregnancy, or can diabetes affect getting pregnant?
Okay, diabetes can and does affect pregnancy. It can, in fact, it may begin by affecting ability to even conceive in the first place. And if a woman is able to conceive even in the face of diabetes, diabetes can affect both the woman and the fetus that she has conceived.
Okay, that's so the baby.
Yes, that's the baby. Okay. Yes, we will call it fetus, but you will call it baby. So
yes.
Yes, so it can affect the mother and the baby that she's carrying in her womb. All right. In fact, if a woman is pregnant and she has diabetes, the presence of the diabetes makes that pregnancy high risk. So there will be a number of issues that can affect the mother and the baby. Like I said earlier, she may even have difficulties conceiving because of diabetes, but if she does conceive, she may face some challenges like an increased risk of miscarriage in the course of the pregnancy. She could also have increased risk of, infections. Most of these problems are due to the excessive amounts of sugar in the blood. Okay, and sometimes if the woman was diabetic before she got pregnant, she may also have some complications, some problems that have already present in her body because of the diabetes. Okay, so I was trying to enumerate some of the problems that could happen when a woman is pregnant in the face of diabetes. So she may have more infections, may be at risk of having infections more than usual. Could have infections in her urinary tract, could have infections in the respiratory system. She could have what we call candidiasis, this vaginal discharge and itching in pregnancy. These things may be more in a woman who has diabetes. She may also be at risk of developing high blood pressure in pregnancy. That's another very special disease that we call preeclampsia, which is a diabetic woman is more likely to develop that. She could have problems with the baby getting really big in the course of the pregnancy, and that has its own challenges, especially when it is time to deliver such a baby. The labor may be difficult. She may not be able to deliver by herself and may be needing interventions from the doctors, either through, to still deliver vaginally, but may need interventions or may outrightly go for abdominal delivery, that's through an operation known as the cesarean section. She could, if she's able to deliver by herself, she could have injuries to, the genital tract because of delivering such a big baby. and she may bleed more after delivery too because of the issues of carrying a big baby and injuries following it. She could also have issues with healing of wounds after delivery, assuming she were to have any wounds in her genital tract or have had an operation. Healing of wounds can become a problem. Um, Sometimes, even before we get to the point of delivery, they may have issues with preterm labor, could have issues with the placenta. Sometimes placenta may be too large, so it comes down and forms what we have, we call placenta previa, or placenta may separate before time. That's known as a placental abruption. That could happen too because sometimes, this what we call liquor that the baby stays in the womb may get to, produce so much of it. So we have what we call polyhydramnios, and all of these complications can arise in the mother when she's pregnant with diabetes. How will it affect the baby? It can affect the baby even while the baby is in the womb. Like I said earlier, baby could start getting bigger, and in the process of delivery, the baby could have injuries, birth injuries, because it was too big to come out through the genital tract. The babies too tend to um, have some problems after they are born. They are so used to the environment of sugar that they had when they were in their mother's womb. And when they come out, that is not there. So they struggle with some, what we call metabolic issues. So they could, they have low sugar when they're born, and even have convulsions as a result of the low sugar. They can have difficulty breathing because of some effects that the sugar has on the maturity of their lungs. And these are a few of the things. They are more likely to be admitted in neonatal care, as they admit them in special baby units, yes, to treat them. And sometimes these are problems that can happen if the baby is big. In some situations, the baby may be smaller than expected, and that has its own challenges, especially in women who have had diabetes for long before they got pregnant. They may have some problems in their blood vessels that may affect the baby. So the baby doesn't grow to its maximum capacity, so they tend to be smaller. Then sometimes the babies can just die in the womb. That's one of the most challenging things that
Painful. Yeah.
happen. Very painful. Baby just dies for no reason. So a lot of times a woman may even have diabetes in pregnancy and it's not picked, and the baby dies. And later when you are seeing such a woman in another pregnancy and you hear that she had the baby die in her womb and nobody could find the reason, often diabetes will be top in our minds because it's a major culprit that does that kind of thing. And another very painful thing that diabetes can cause is congenital malformation to the baby. Babies can have congenital malformation, especially to their heart. They have heart problems, they are born with heart problems, or spinal cord or brain issues. They can have problems anywhere, but the heart and the brain and spinal cord are the ones that are commoner. Okay,
Okay.
then when they are born too, they tend to have a higher risk of infection, just as the mother had too when, when she was pregnant with the baby. Baby can also have a higher risk of infection or jaundice after they are born. So these are some of the ways that diabetes can actually affect pregnancy. And from all I have said, you can see that it is really, really an important issue, and it can affect so much in both the mother and the baby. Diabetes can cause a lot of problems, to a person, and it is worth taking note of. And so that anything that can be done to prevent any of these kind of complications should be done anytime that diabetes is present in a woman who wants to get pregnant.
Wow. I didn't know you were going to say so much. It affects the mother, it affects the baby, and it can even affect even before getting pregnant, during pregnancy, after. It's a lot to take in. Hi, have you heard of Soyo, the new diabetes care app? Studies show that the best medicine to take for diabetes is to get education about it. Because if you understand how it affects your body, you'll know better what you need to do to fight it. It will also help you to take care of someone else with diabetes. With the app, you don't just get education, you also get to make your management plan either for yourself or the person you're taking care of. There are also lots of other features like meal plans, medication, and other reminders to keep you on track. And if you fall off, don't worry, just get back on. This is how families can live healthy and happy with diabetes. Don't be left behind. Download the app at soyo.web.app to care for yourself or someone else with diabetes. So, what is polycystic ovarian syndrome and how does it affect pregnancy and high blood sugar? Or what's the relationship?
Okay, all right. Polycystic ovarian syndrome, for those who have heard that name before, is a metabolic condition. What really is happening in that condition, if I'm to just describe what's going on, is that the ovaries of the woman affected become enlarged. Okay, they're bigger than usual and they contain a lot of small cysts that are swelling with fluid in them. So they contain a lot of cysts and produce hormones abnormally. Okay, so the ovaries of a woman are very important reproductive organs, and that's where eggs are produced. Eggs are housed and matures and are, they are grown there and released from there. The ovaries also produce hormones. These female hormones, the estrogen and progesterone especially, regulate so much in the body of a healthy woman. They control her menstrual cycles and they interact with other hormones in the body to ensure her health generally. Okay, so these hormones are very important. But in a woman with polycystic ovaries, the ovaries are not behaving normally. They are swollen and instead of the usual eggs we see, they have cysts in them instead, small cysts that produce hormones in an abnormal way. So you may be hearing things like hormonal imbalance. That is
Yeah.
something that polycystic ovaries do because they don't coordinate themselves in producing hormones as they should. And sometimes they are producing hormones that they shouldn't produce. Okay, so the end result of this is that the woman starts to experience some difficulties during her menstrual cycle. She may not be seeing her menses at all. So she starts having menstrual irregularities. Menses are coming every 2 to 3 months instead of every month. Menses are cyclical, so they come in a time frame of between 21 to 35 days in normal women. But for somebody with polycystic ovaries, she may start having very long cycles. They become so long, you don't see menses until 2, 3 months, 4 months. Sometimes they may not see at all for a while. And they are also producing androgens. These are male hormones that a woman shouldn't produce to that extent. So when they start producing these hormones as well, there are other features they may notice like loss of hair, deepening of their voice, growing excessive hair on the body, maybe on the face. So when the woman starts having hair under her chin or the side of her face, that could be an issue. Or hair on the chest or abdomen, which is not usual for women. So this could be seen in a polycystic ovaries. And then they may also, begin to gain weight unnecessarily. It's not the usual way. They just notice they are getting bigger and bigger. Okay, so this is really a metabolic disease and it's in a spectrum. What we do understand of this disease is that it exists in a spectrum with metabolic issues like diabetes being on that spectrum as well. So a woman with polycystic ovaries is more likely going to develop diabetes than a woman who doesn't have polycystic ovaries. In fact, a lot of times we see women with polycystic ovaries are already having issues with the fundamental problems that cause diabetes. So they're having insulin resistance. And we may even have to treat them with the drugs that are used to treat diabetes a lot of times, and you get response. So there's this relationship whether one is causing the other is not very clear as at now. Whether the polycystic ovaries is causing diabetes or diabetes is causing polycystic ovaries, not very clear. But we know that there's that association, and you may see that happening in some people. Okay, and even the complications of pregnancy very, mirrors what happens in diabetes. So if a woman with polycystic ovaries does get pregnant, in fact, one thing I didn't mention earlier is that is a major cause of infertility these days. Okay, so causes women not to ovulate. From what I'm saying, when they are not seeing their menses, is because they are not ovulating. So when they are not ovulating, pregnancy becomes a major challenge. And when they are not getting pregnant, that is what we see commonly. But when they do get pregnant, they may now have the risk of developing diabetes in that pregnancy, even if it was not obvious before they got pregnant. It may now manifest in pregnancy, and with all its attendant complications like I have just enumerated. Okay, so this is the way we see polycystic ovaries and diabetes interacting with each other.
Wow. So from what you are saying, you are seeing more women with polycystic ovarian syndrome nowadays.
Oh, yes. In fact, in those days, frankly speaking, the time I went to medical school, not that it's so long ago, but it's been a while, and we studied polycystic, we could, and all of a sudden, it's either then we were not, it wasn't being diagnosed because maybe we didn't have all we needed. I remember then things like ultrasound scans were really far and few between. But these days we have scans everywhere, so you can quickly just scan a woman and see into the ovaries, and you could just see the typical polycystic ovaries. So women have always been having hormonal imbalance, but we may not have been picking it as actually being polycystic ovaries. Okay, but these days it's easier to diagnose, and it affects almost 10 to 15% of women in the reproductive age group. So that's quite a significant amount.
Yes, that's a lot.
Yeah, that's a significant amount. And when you're in
Because
the clinic, yes,
that is like 1 or 2 in 10
yes,
women.
about 1 or 2 in 10 women. So it's a problem that is with us. And when you sit in the clinic to see patients that are complaining of inability to get pregnant, you're going to see that many times in about another, when you categorize them, and you see some due to tubal disease, some due to anovulation, almost all of them that are due to anovulation will be because of polycystic ovarian syndrome. So it's something that is worth noting, and we're actually seeing more cases of that these days.
I see. Okay, so we've talked a lot about pregnancy. One thing that quite a few women go through is miscarriages. So what's the relationship? Does diabetes also cause a higher chance of miscarriage?
Yeah, even when I was talking about the problems earlier, I think one of the first things I mentioned was even if a woman with diabetes gets pregnant, the chances of miscarriage is higher. Okay, well, yes, diabetes will cause a higher, to increase it would. And there are a number of reasons why we think so, okay? Um, I don't even know where to start from in explaining this, but let me say, if you want to look at the disease itself, when a woman that is diabetic gets pregnant, especially if the diabetes is poorly controlled, so she's not doing very well, she's already sick, and inside her body, the environment is not conducive for a pregnancy. So usually pregnancy is threatened by, ill health generally. So once there's ill health and things are not in the order they should be in the body of a woman, pregnancy staying becomes a challenge, so it may not stay. Okay, but beyond that, we believe that there are some, real genetic things going on as well. We think that sometimes in women who are diabetic, they may have poor qualities of embryo, that there may be increased genetic mutations inside the embryo. And once there's a problem with the embryo, the embryo is there, but it will not grow as it should, and then there will be miscarriage. So there's some damage to DNA, even down to that level in diabetes, so poor embryo quality. We also think that they may also be experiencing some failed implantation, either from the hyperglycemia, the too much sugar level, or from what I just explained about the poor embryo qualities. Then there's also the issue of age. Diseases like diabetes tend to begin to manifest as people get older. So when you say a woman with diabetes in pregnancy, likely she's on the older spectrum of maternal age. And when women are at that spectrum, generally, they also, just because of age, may have poor quality embryos. So, the age and the disease may all be playing a role in leading to
miscarriage.
So this is what we have observed, that there's higher risk of miscarriage in a woman with diabetes.
Okay, so I'd just like to ask this question. If a woman is diabetic, you've talked about the problems that can happen during pregnancy. Will she automatically have a baby that will be diabetic as well?
Oh, no, not at all. The fact that a woman is diabetic does not automatically mean that her baby is going to be diabetic. Though diabetes is a genetic disease, so it is passed in the genes, but its manifestation is, will be affected by other things in the environment as well. But if a woman is diabetic, then she may also have the genetic predisposition, be able to pass that on to a baby. But that doesn't necessarily mean that the baby must have diabetes. The baby may have an increased risk of developing diabetes later in life, but not necessarily because the mother is diabetic, then that baby must be, no. Okay, but the risk may be higher for the baby if the genes were passed and if the environment is not controlled later in the baby's life. Then there are also some in utero experiences, or what fetuses or what babies go through in the womb of their mothers that are taught to play a role in their lives later. This theory is something they call epigenesis. I don't want to go into explaining it too much, but because of such theories, they believe that babies who are exposed to a certain environment, like high blood, too much sugar while they were developing, may now, there's an adjustment that their body will make that tends to make them more predisposed to having that disease later. Okay, but these are all factors that just come to play. It's not sacrosanct that the baby must have. But if these things line up and the person in adult life, has some other environmental issues like excessive weight gain and certain habits, it may all play into the hand of developing diabetes. I don't know if my answer is clear enough.
Your answer is very clear. So if the baby is predisposed and then the baby stays in an environment where they don't exercise much, they eat a lot of carbohydrates, stuff like so, it's very clear. So let's go to the interesting part of the discussion. This is the part I've been looking forward to. Okay. What can pregnant women do if they are diabetic or if they discover they are diabetic so that they have healthy baby, healthy mother, happy family at the end of the delivery or the pregnancy?
Okay, all right. I'm going to approach this question in two ways. Okay, that's because we have women who discover that they are that they are diabetic for the first time in pregnancy. And there are women who know that they are diabetic before they get pregnant. So we have two categories of women there. If a pregnant woman is diagnosed, or if we notice that a pregnant woman has diabetes, so she will fall into one of two categories. Is either she never knew before and she just developed it or got to know in this pregnancy, or she was diabetic and she was aware and then she's pregnant. Now, for the first group that I said we've diagnosed in the pregnancy for the first time, I will still divide them into two. There are those gestational diabetes. That means the diabetes is coming because of the pregnancy. There are some metabolic changes of pregnancy that is predisposing that woman to the excessive blood sugar and not being able to control their sugar. Okay, those types believe go away after the pregnancy. But then there's also the type you diagnose for the first time in pregnancy that she didn't know, or it's manifesting for the first time in pregnancy and it will not go away. Now, in talking about what to do, I will start with the first category of women who knew that they were diabetic. So if any woman knows that she's diabetic and she's contemplating pregnancy, in order to prevent, all the different complications or problems that I've already talked about, it is best that she, gets herself assessed and is in full healthy condition before she conceives. So what should she do? I would advise that she should basically see her doctor. And if any woman is diabetic, she should be seeing a doctor. She must have some care and good care. So she should have contact with the health team regularly, where she's checked and assessed. So if a woman that is diabetic is considering pregnancy, she should see her doctor for a review of her health and the diabetes before she even starts trying to have a baby. Okay, and she should do this at least 3 to 6 months before she gets pregnant. So she should be healthy, blood sugar well controlled, every complication possible treated or controlled as much as it can be before embarking on the pregnancy. There are
So
certain problems.
sorry, I want to just repeat what you said. So at least 6 months before she starts trying to get pregnant,
Yes,
she
at least
should
6
go
months.
have herself checked and ensure that she's in the best state of health possible.
Yes.
Okay, go ahead.
Okay. And I say this because sometimes the blood sugar is not controlled and the woman gets pregnant, the problems will be much more in that scenario. And then there are even some diabetic women that the counsel the doctor will give them after assessing them is, please don't get pregnant. So
Yet.
if there are existing problems that have affected maybe nerves, affected blood vessels, affected issue vessels in the eyes, a woman with what we call retinopathy or neuropathies or nephropathy especially, shouldn't even talk of getting pregnant, because pregnancy is going to worsen those conditions and may cause irreversible damage to those organs. All right. And then the presence of those problems can also have an adverse effect on the pregnancy and predispose her to some of those things we are talking about. So if any diabetic should see a doctor. This is very important. I wish I could write this say it in capital letter, if there's any way of speaking in capital letter. I'm bolding what I'm saying and underlining it just for emphasis. Okay, so she should see a doctor. And the doctor will check her. She will then monitor her blood sugar regularly. She will take her anti-diabetic drugs, whichever one she's been on. She will be on a healthy diet that can control things, and she should be exercising regularly. Her weight, healthy
Weight.
range, height. Okay, so yes, so the doctor will let her know what her healthy weight range is. And this is important because you're obese and you're pregnant, those are separate issues. Then there's diabetes, those issues. Okay, things can really get out of hand. So she should get into a healthy weight range before she gets pregnant. She should quit smoking if she's been smoking. And if she's taking alcohol, she should also quit alcohol. I know that in those days, we used to talk about a healthy range of alcohol for a woman. But these days, we don't even want a woman who is contemplating pregnancy to take alcohol because of the effect of alcohol on the baby. And she should generally reduce her stress and anxiety levels around this time. So once she receives a clean bill of health from the doctor, she can go ahead and get pregnant. But like I said, she should have done all this. They would have assessed to make sure that there's no problem, and then usually will be drug called folic acid. Prepare her body for pregnancy, and it helps with the brain and the spine. All right. So any diabetic woman must access preconception care. Pregnant, that she has conceived, and then care. The woman who is being diagnosed for the first, she also receive care, and based on when she's being seen and whatever problem she has at the time that she's being seen. Okay, but during like I said earlier, most of the complications with pregnancy occur because of the high blood sugar level seen in diabetes. So the major aim of treatment of a pregnant woman who is diabetic is blood sugar
control.
complications can be minimized. All right. She starts antenatal care, she starts antenatal care. In fact, and generally the weeks. So a woman, any woman that gets pregnant will wait till she's about 3 months, between 3 to 4 months to start antenatal. Will not hold for her. As soon as she gets pregnant, she can start taking care. That's because sometimes there may be need to check, especially if she was diabetic before the pregnancy, the medication she's taking may need to know if she's supposed to continue that particular drug or change. Another thing that happens when a woman gets pregnant is that because of the changes, metabolic changes in pregnancy and all the pregnancy hormones that are just running amok in the body of a pregnant woman, blood sugar can become difficult to control. So whatever was controlling blood sugar before she got pregnant may not be sufficient. So she needs to come in for care immediately so she can be monitored to make sure that she's taking proper drugs or receiving or doing the proper things to make sure that the sugar is controlled. Because like I said, if the sugar goes out of hand, then complications can begin. And it is also very important for her to come in early because the organs are being produced in the fetus, in the growing baby, at that early stage of pregnancy. Usually what we call organogenesis is almost completely done and executed between 8 to 12 weeks. Some people don't even realize they're pregnant then. Okay, so, and this is when the congenital malformations take place, is when organs are being formed that the anomalies happen. So if a woman misses that important period and doesn't get care, then you can begin to see some of those complications, showing up. So a woman who is diabetic, she must, her doctor, the health team, they are one of the most important people in her life, and she has to keep close to them, even in the course of her pregnancy. So during pregnancy, like I've been saying, we're going to monitor blood sugar. It's important for a diabetic woman to have access to monitoring of blood sugar, regular monitoring of blood sugar. And she can be taught how to do it. So we even want them to be able to monitor it themselves, self-monitoring of blood sugar. And she can get a glucometer. There's these devices that are very simple to use. Anyone can actually use them if they are taught properly. So a diabetic woman should have a glucometer, especially if she's pregnant, so we can monitor the blood sugar. Monitoring of blood sugar is a major intervention in treating diabetes in pregnancy. Okay, then of course, like I said earlier, our diet, our drugs, and then another important intervention is monitoring the fetus. Okay, so because of the problems that the fetus could also have in pregnancy, we need to monitor the fetus while they are in the womb. Okay, so we do what we call antepartum fetal surveillance. So we have different ways of doing it, depending on the stage of the pregnancy or whatever problems that we could be seeing. Okay, so the fetus is monitored so that if there are any complications, treatment could be instituted. Another thing that a diabetic woman would benefit from is assessing to know when to deliver her and how to deliver her. Okay, so like I said at the beginning, any pregnancy in the face of diabetes is already a high-risk pregnancy. So there are lots of things that can happen, and there may be times you may need to intervene and end the pregnancy. You know, I don't mean abort it, I mean make
Deliver
her
the baby.
before it is time for her to go into labor, depending on complications. Hello?
I'm here, I can hear you.
Hello? Okay. So if there are certain complications that have ensued, and you may need to deliver such a patient or such a woman before the due date. Okay, so you may, all right? So in fact, a lot of obstetricians are reluctant to allow a woman that is diabetic to go all the way to her due date, and because we have this concept of babies just once the baby is healthy and things are moving well, take a decision to deliver. Okay, the baby should be delivered is, you know, major decision that should be taken, and that will depend on the condition of the baby, the condition of the mother, the size of the baby, like I said, and any other problems that could be existing in both the baby and the mother. So sometimes if the baby is too big, to avoid some of those traumatic injuries to both the mother and the baby, you may want to, you know, do a surgery, a cesarean section to deliver the baby. And if you don't have access to this kind of care and decision, then you may not end up with complications like shoulder dystocia, which I didn't even mention earlier. You know, that can happen in diabetes, where the woman is delivering the baby, the head comes out and the rest of the body refuses to come out because the baby is big. So, and you know, when that happens and the baby is not delivered after a few minutes, then the baby dies and the mother is left with a lot of injuries to the genital tract. So, you know, a diabetic, like I said, must keep seeing her doctors down to the, you know, the last stage of how should the baby be delivered, when should the baby be delivered. And it doesn't end there. When the baby comes out, such babies need to be seen by the neonatologist. That's what we call doctors who treat newborns. So the baby needs to be seen by a doctor, needs to be monitored, needs to be checked for at least a few hours or a day at least. I know they can stay up to a day sometimes with the neonatologist, just to make sure that all is fine. If there are no problems, then the baby can be discharged to the mother. But not to check the baby and to assume the baby is fine is not safe for the baby. Okay, so these are some of the things that can be done. After delivery, the woman is continued to be monitored to make sure her blood sugar is controlled until, you know, after a period of time with the obstetricians, she can be sent back into regular care with the doctor who was seeing her before she got pregnant. So this is what we do. If there are complications, they are treated, you know, depending on what they are and on their own merits. So I think this is a summary of how we, what we do,
That's a
what should be.
long summary, but the summary of the long summary is that women who are diabetic are in close partnership with their doctors when
Exactly.
pregnant and their health team. If you can't
Exactly.
remember anything, just remember that your doctor is your friend, especially when you're
Right.
pregnant.
Best friend.
Best friend,
Best
yes.
friend.
So there are so many supplements around these days. What is the role of supplements in helping women who are diabetic and who are pregnant, or who are diabetic and who are trying to get pregnant?
Okay. Supplements generally are usually vitamins or minerals that we actually eat them in our meals, but maybe sometimes people feel that they need to add up to what they're already getting in the meals, okay, if it is necessary at all. But when it comes to diabetes and pregnancy, one of the most important supplements we recognize is folic acid. I mentioned it earlier. So we
Yeah.
would even advise a woman who is trying to get pregnant and she's diabetic to be on folic acid. And even in the early stage of the pregnancy, she will take folic acid before she starts to take the other supplements like iron, which all pregnant women do take as well. Okay, so the stores in the body of iron and folic acid sometimes are low in women, especially in this part of the world. So we give them those when they are pregnant to make sure that they don't deplete their stores completely and develop anemia. That's one reason. That's low blood levels, which have their own set of complications, or to prevent congenital malformations in women, especially diabetes. That's what the folic acid does basically. Okay, aside from this, um, most other supplements we need should come from our meals. And if anybody wants to take supplements, I will advise them to talk to their doctor about it before they start to take. And by no means will supplements ever take the place of the drugs needed to control blood sugar in a diabetic. So don't ever believe anyone saying that if you take a particular supplement, it's going to cure the diabetes, it's going to take it away, and all of that. No. Okay, supplements will not do that. And you need your anti-diabetic drugs to remain healthy. You need to eat, a good diet has been prescribed, and you need to exercise and take all those measures the doctors have told you. You may take supplements, but they cannot replace all these other treatments. And it is advisable to discuss with your doctor before you even start to take supplements beyond what I have described already.
Thank you so much for that. So, family members, we are all part of the family. What can they do to help?
All right. Family members are very, very important in the management of diabetes generally, and even when women are pregnant. Okay, there are a number of things that family members can do to help. They can offer support and encouragement. Okay, I think maybe the basic role of family members is to offer support and encouragement. The fact is, battling a disease can be a very distressing, situation. It can also be a very lonely place to be, especially if you are the only one with that disease around and people don't know what you are going through. You are told to live your life in a certain way. It looks as if there's some restriction around you, and you just don't feel the way you used to before you had that disease. So it can be challenging. Okay, but as with challenges generally in life, if you have people who can be with you, who can support you, who can encourage you, then the journey won't look so difficult anymore. The road will not appear too lonely anymore. So this is where family members come in when it comes to managing diabetes. So they offer support and encouragement. So family members, if you're a family member of a diabetic, you're a very important person. You will play a major role in ensuring that your relation remains healthy and is able to access care and get help when needed. So some of the things a relation can do or family members can do is that they can acquire some basic knowledge about the disease. Okay, just you don't need details, just basic knowledge of what it is about, what the problems can be, and a few things about how people can, you know, help or how they can access care. So you will also be important as a family member in encouraging the patient to eat healthily. Healthy eating is a major way of helping or controlling this disease. So, a healthy eating is not very easy. Exercising is another thing.
Okay.
It's true. Healthy eating is it's easier said than done. So if you have people encouraging you to do it, then it becomes easier. Exercise is another intervention in managing this disease, and exercise too is not a very easy thing to do. People always make up their minds to exercise and never really get to do it. Okay, but if they have family members who understand, who join them on the exercise. So family can just join her and choose something that is simple enough to do, maybe walking. Again, when it comes to the issue of healthy eating, when they are eating healthy, then it becomes easier for the patients to also join them. And if you're taking too much of what you shouldn't take, and the patient is watching you, it's going to become difficult to overcome the
Yeah.
temptation of joining you. So these are things you can just be deliberate about it, that you are also going to start eating healthily so that the patient can be encouraged to do the same. Then we also can encourage the patient, the woman, to um, change some of their lifestyles that are not going to help. Maybe the person smokes or drinks, things like that. You can encourage those lifestyle changes. Then you can encourage them to visit their doctor. You can remind them of appointments. It's time to see your doctor. You can even follow them, can offer to take them. Sometimes it's not very easy to just get up and go see the doctor. When people think about hospital, they get discouraged when they remember, oh, you get there, then you have to wait a bit, get your card. That can really discourage people. But if there's somebody that will accompany them, keep them company, help them run around in the hospital, it can become easier. So if it is possible, encourage them to visit their doctor and go with them. Then another very important role family members can play is to be watchful for symptoms of complications. I think I didn't mention this set of complications in the beginning, but they happen too when women are pregnant. We have what we call these acute emergencies or complications of diabetes, where a person could either go hypoglycemic, where the sugar level crashes. That can be a fatal complication. Or you have very high levels, the sugar level just gets very high, and they go into some kind of coma. So there are usually warning signs of this kind of thing. So if you have some basic knowledge, you will know the warning signs, then you can be watchful for such symptoms. Okay. When the blood sugar starts dropping, you may begin to observe some changes in the person, your relation. You notice they start sweating, they start shaking, and they're feeling weak. You may think that this is hypoglycemia. So you can watch out for such symptoms if you know about them. And then you can intervene for the ones that you can intervene. And the ones that you cannot, then you can quickly look for help when the help is needed. You can also encourage them to take their drugs and to monitor their blood sugar. So if you have a glucometer, you can offer to come and be checking the blood sugar for them regularly. That's something you can do. And then we also encourage diabetics, if possible, to find and join a diabetes support group. Okay, I know that there are some of them around, and if your relation is in such a group, or you may for such a group for them and encouraging them to join. And when they belong to such a can, accompany them or encourage them to attend the meetings and accompany them. Don't nag them. They may not want to. You may say, check your blood sugar or do. I explained earlier, there is not a very easy road to walk. So you just provide empowerment, and don't nag them. It can be a big turn off. Okay, so I think these are some things that family members can do to help a diabetic.
Thank you so much. If there was one piece of advice you give any woman who is diabetic and who is contemplating getting pregnant or who is pregnant, what would it be?
Okay, I would say that, well, you can get pregnant if the conditions are right for you, but don't embark on that journey without seeing the doctor, without going to the health team. So if you're a diabetic woman and you've been living with diabetes, of course, I'm sure by now you know that that is not the end of your life, and you know that you can actually live a healthy life if you do all that needs to be done, and you can live long. Okay. You can also have a baby if there are no contraindications, no reasons not to have a baby. Just do it right, see your doctor, get everything in control before you attempt the pregnancy. And when you do attempt the pregnancy, remain in close contact with your health team. Ensure that you are seen and managed throughout the pregnancy till the end. And if you're already pregnant and you're diabetic, maybe they just diagnosed you, it is also not the end of the world. There is help out there and you can be helped. You can go through the pregnancy with minimal complications. You can be successfully treated. But please, by all means, access care as soon as possible. Thank you very much. That would be my counsel.
Thank you, Dr. Arichi. So you've heard it all. Diabetes and pregnancy can be handled properly. All you need to do is follow the necessary steps. Your doctors are your best friends, as Dr. Etty has said. So access care, and it's important to remember access care before getting pregnant, not after. So thank you very much for listening. I'm sure you've learned a lot. I also have learned a lot. And we'll see you again next time. I'm glad you took my advice and watched the video till the end, and I hope you learned a thing or two. So don't forget, watch the next videos because there's still lots of information that will be really beneficial to you. Don't forget soyo.web.app. Download it now. See you in the next video. Bye.